Welcome to Real World, Real Talk with Dr. D.Z. Cofield. The show represents captivating conversations and insightful information to encourage and inspire you with all you need to become the best you can possibly be. And now, your host for Real World, Real Talk, Dr. D.Z. Cofield.
Welcome to Real World, Real Talk. I'm D.Z. Cofield, Senior Pastor at the Good Hope Missionary Baptist Church and your host for today's show. I want to welcome you to your publicly supported radio station as we share with you from a subject that we have talked about over the years, trying to raise awareness, but not only raise awareness, raise a level of accountability to move people to action. And that's breast cancer awareness. This is Breast Cancer Awareness Month, the month of October. And it's always important to raise this issue because of the effects that it has on so many women. But it's also important, I think, even now, coming out of the COVID-19 pandemic, some would say we're in the endemic. But at the end of the day, COVID-19 has taken the headlines by storm over the last 2+ years that many people have forgotten. People are still dealing with those ailments, those issues, those illnesses, those diseases that were present and prevalent before COVID-19. In other words, it's not like breast cancer diagnosis and infections have gone down, HIV, AIDS, prostate cancer, you go down the list. It's not like those things have gone down. They've just been moved somewhat to the background because of COVID-19. And so today we're going to talk about this very important subject. And if you have a woman in your life, if you are a woman, we want you to get this pertinent information. If you're a breast cancer survivor, congratulations. But for some of you, you don't know right now that breast cancer is in your future. And just in case you think it's an old lady's disease, let me share this with you. We have a guest on today who is a breast cancer survivor who was diagnosed at 21 years of age. That's right, 21 years of age. You want to hear her story. Now, just a couple of housekeeping matters before we move further. If you'd like to follow me during the week, you can follow me on IG, Instagram at DZ Cofield. You can follow me on Twitter at DZ Cofield, and you can follow me on Facebook at, you guessed it, DZ Cofield. Let me introduce my guest on today's show. First and foremost, she is a friend of this station. She's a friend of this show. We have been working together now for several years, and that's Dr. Jenny Bennett. Dr. Jenny Bennett is a 26-year breast cancer survivor. Every year I have her on, and so we get to add to that number, and I'm really excited about that. She is the founder and director of Reconstruction of a Survivor. It is a support group that is curriculum-based to help women, to help families deal with the aftermath of breast cancer. And we're happy to have her with us today. We have Dr. Colleen Silva with us. She is a surgical oncologist and director of breast cancer services at UTMB. She specializes in breast cancer surgery. She specializes in breast cancer surgery. And then we have a young lady with us. Amber is 25. Amber is a student at U of H downtown. She works for Amazon, but at 21, she was diagnosed with breast cancer. She now volunteers with Reconstruction of a Survivor, and we're happy to have them with us on today. Dr. Jenny Bennett, Amber Thomas, Dr. Colleen Silva, welcome to Real World, Real Talk. How are you ladies doing?
Fine, thank you.
Doing great.
So, Dr. Bennett, let's start off with you. You have been working with Reconstruction of a Survivor. You're the founder of Reconstruction of a Survivor. You have 9 campuses, sites where you are serving people as a support to them. So let's talk about first your breast cancer journey. You're a 26-year survivor, and then the birthing of Reconstruction of a Survivor, how that came about.
Wow. Thank you, Dr. Cofield, for having me on the show again this year. It's always an honor and a pleasure to share information and knowledge. I was diagnosed with breast cancer, as you said, 26 years ago. However, I did not have a mass at the time that was palpable. So I had a nipple discharge and came back to Houston. I was speaking at a national math conference in San Diego and had a discharge, didn't know what it was and never had it before, and called my surgeon. I said, this is what's going on. And he said, well, we'll do a mammogram, ultrasound, and galactogram. And came back, they did all that, and he did a biopsy, and he came back and said, I'm sorry, it's breast cancer. And from then on, I had surgery. I had a lateral because it was only one breast. And back then, they did not do prophylactic mastectomies. They only did, this is a diseased breast, we get rid of it, and then that's it. So they did that with Reconstruction. I could have died after surgery because I had a blood clot to form. And if it had traveled, then I would have been out of here. So I told God, let me out of this, get me through this, and I will do all that I can to help women who've been diagnosed or undiagnosed with breast cancer. So we started Reconstruction of a Survivor. It's a curriculum-based support group sessions that we have connected to scripture every single session, including eating healthy, exercise. We've got a session on I Will Forgive, on forgiveness. We've got one on it's okay to cry, because oftentimes some men, not all men, will say, suck it up, stop crying. Can't help it. Because oftentimes the women first think, I'm going to die. What's going to happen to my children, my family, etc. So therefore, we try to put them at ease as they go through the journey. Or if they're through the journey and still need support, then we're here. We also provide financial assistance to the women who are in the support groups. And then last but not least, we in fact, we got one coming up in February on the 11th. We provide for undiagnosed women, African-American women, breast health education and sessions in a fun way. And we call those pampering with a twist, because we do pamper them. It's like a ladies' day out, but you also get the breast health education. And so Dr. Silva has been a part of all this and will continue to be, as well as Dr. Whitman from MD Anderson.
You know, over the years, we've always heard that cancer is best treated when it's detected early. And the standard has always kind of been, the self-examination. I can remember seeing commercials and when you take a shower every day, examine yourself. And I'm sure there are specific ways that you tell women to do that. But talk about Dr. Bennett's experience with the nipple discharge and how common is that?
Dr. Cofield, I was shocked. I always thought breast cancer was going to be some type of mass. And I did self-exams, but the lumps that I felt were actually lumps for fibrous cyst, which means it's a sac of, and Dr. Silva can correct me on this if I'm not right, sacs of fluid, and thinking that, okay, this is just, fibrous cyst. Well, but I didn't have anything that was determined as a mass, because I saw the nipple discharge. It was on my pajamas. And as I said, I was out of town, and I just gotten my notice to say it's time for a mammogram. What did I do? I don't have time for this. I threw it in the trash can. And that's when I flew out of town, and I guess God said, I'm going to fix you. You're going to pay attention to this or not. And that's when the nipple discharge happened, and came back, had the test, and then subsequently had a lateral, which means they removed one breast with breast reconstruction at the same time.
So Dr. Silva, how common is that?
It's not that common, but it's definitely known, and that's why we pay attention to it. One of the things that women come to see me for who have not been diagnosed with breast cancer is for nipple discharge. So there's certain types of nipple discharge that we need to pay attention to. If the nipple discharge is spontaneous, meaning it's leaking out on its own, as Dr. Bennett mentioned, she saw it on her pajamas. If it is bloody, that needs to be paid attention to. And also, if it seems to be coming out of one one opening on the nipple instead of multiple openings on the nipple. You can have nipple discharge that's completely normal. That's part of fibrocystic changes like Dr. Bennett mentioned that she had. But that usually is coming out of multiple ducts. It's usually just there if you check your nipples and you squeeze or check for them. But this is the suspicious kind is it's leaking out on its own. It may or may not be bloody, but bloody is important. And also seems to be coming from one duct on the surface of the nipple and usually in one breast. That needs to be paid attention to. And we'll do what Dr. Bennett's doctor did. We'll get a mammogram, we'll get an ultrasound, we'll get a galactogram, and these days we'll get a breast MRI. But if nothing shows up that we can actually specifically go after to biopsy, then we'll actually take the patient to the operating room and we will try to find that duct and biopsy that duct in the operating room because it does need to be figured out.
So for someone who needs explicit directions that's listening right now, is there kind of a rule that if you see blood or you don't see blood, or you see it coming from multiple ducts or only one, the difference between what's normal and what's abnormal? Or should a person who has nipple discharge of any kind, because I can hear somebody saying, okay, wait a minute, hold on, I don't even know what kind I have, I'm going to the doctor. Like, is that the safest course of action to take if you have any kind of discharge?
It's always good to bring up those kind of questions and concerns with your primary care doctor. Maybe that's your family medicine doctor, maybe that's your OB-GYN doctor, but let them help you sort it out. So that's always the best thing. Ask somebody if you don't know. Nobody's expecting you to find your own breast cancer. We all need help on this. We've got to work together. So that's the first issue. But specifically, takeaway points. If you see bloody nipple discharge, that needs to be investigated. If the discharge is leaking out on its own, meaning it's not just coming if you check yourself monthly or after you have a mammogram, but it's leaking out on its own onto your clothing, onto your bra, onto your pajamas, and it doesn't have to be a lot. It can be a small spot that you see. That should be investigated. Those are kind of the two takeaways that I would stress.
Okay. If you're just tuning in, you're listening to Real World, Real Talk. I'm your host, Dr. DZ Cofield. Today, we're talking about breast cancer because it is Breast Cancer Awareness Month. And I have with me in the virtual studio, Dr. Jenny Bennett, Dr. Colleen Silva, and a young lady, Amber Thomas. And I want to hear her story now, as I know you do. Amber, at 21 years of age, you were diagnosed with breast cancer. How did that come about?
So for me, I also had the same situation as Dr. Bennett. I woke up and I would find like little droplets. It wasn't, more than probably 3 or 4. And it was like a light pink. So you would assume it's, blood discharge. So I called my mom and I told her, and she was like, it's not normal. Because at the time I was attending Texas State University. And so she immediately asked me to come home. I went to the doctor, and my first appointment was actually the opposite because I was told that I didn't have to worry about anything. After I told my doctor, she was like, this is normal. It's nothing to worry about. And so, I asked her again, and she said, yeah, you're fine. So when I walked out, I went back to the car, and I told my mom what she had said, and my mom's like, this is not normal. You have to go back in. So we went in, and I just remember asking to see her again, and I asked her, could we get a third opinion? And so, at first she was like, it's really no point. I promise, this is going to go away. And then finally we convinced her to get a third opinion, and she sent us a recommendation. So when I had went to the car, I just looked up breast specialists in Houston, and the first person I seen was Dr. Terry. And when I went back in, when I got the recommendation, I asked her, could she recommend me? Can she send a letter there? And as soon as I got to the breast specialist on my very first visit, she seen it. Because at that point it had become a lump. It went from discharge to forming lump right at the top of my areola.
Wow.
So that's how I found mine.
Dr. Silva, is Amber's experience the norm, I think, for many young women in particular? Because, when you talk about screening for breast cancer, that's not typically something you do unless you have a family history of it in your 20s. Was that kind of normal? And I'm not trying to cast aspersions on anyone in the medical profession, but I think there may be a lot of young women in particular who are sitting there because, Amber, you don't have a family history of breast cancer, do you? Or do you?
No, sir. I do not.
Is that kind of normal to kind of think, hey, I'm in my 20s, I'm healthy, I'm vibrant, I'm a college student, that breast cancer is not something that I would have to readily deal with? Dr. Silva?
So I would say that is probably fairly common response and when the patient first comes in. No one likes to think or doesn't want to even contemplate a 20-year-old woman sitting in front of you having breast cancer. So it's not top of mind. So immediately you're going to think, oh, this is fibrocystic changes, or this is something going on with her hormone cycle. That's not going to be the first thought that comes into your head. But it is important to ask about family history, because if the patient says, by the way, my aunt had breast cancer when she was 30, and I have a cousin who had breast cancer when she was in her 20s, that should start sending off some red flags immediately. The blood part, the pink part, to me, that was concerning, and I'm very glad that Amber and her mother were persistent and did not take the first response that they got. But I won't fault the doctor who thought that it was going to be fine, because, again, what Amber experienced is very rare. It's very rare. Amber, do you mind if I ask, have they done genetic testing on you since that happened?
Yes, ma'am. I had it and it was nothing.
Good. And that's also important. We're learning more and more about genetics and how things can pass through families every day. When I first started my training, we were just learning about the breast cancer gene, and most people call it the BRCA1 and the BRCA2, and that was all we knew. And for years and years and years, that's all we knew, and we tested people for that. Now, there's probably 10 or 12 genes that have been identified that can be associated with increased risk for breast cancer. And so just because you got tested for a certain set of genes at one point, 5 years later, 10 years later, you may need to be tested again, because they may have discovered a new gene that if they test you for that, you do have that gene. So I think that's important, that genetics is constantly evolving and we don't understand it completely at all yet, but we're learning more every day. So genetic testing is very important, but people who've been tested in the past may need to be tested again 5 or 10 years down the road if new genes have been discovered. Also, I don't want to take up all the time, but genetic testing used to be really, really expensive, and people didn't want to do it because it could cost $5,000 to get genetic testing. Now it's pretty much universally covered by insurance, and that includes Medicare and Medicaid. And even if your insurance does not cover it, the out-of-pocket expenses for the patient have come down to somewhere in the neighborhood of $200 to $400. So people who might not have wanted to be tested in the past because it just wasn't financially feasible for them could hopefully be tested now, based on the significant change in the price.
Dr. Silva and Dr. Bennett, I want each of you to talk about the persistence of Amber and Amber's mother and how important that is to medical care. I think so many times when patients go in and talk to doctors, and doctors give them their opinion, many patients don't just take it as an opinion and recognize the importance of their own opinion, and that they have the power as a patient to insist upon a test, an examination, to make sure that their mind is at ease. Can each of you talk about that? Dr. Bennett first, as somebody who advocates for women, and Dr. Silva as a practicing physician, how do you feel when a patient comes to you and they're informed and they're insistent about some things? So Dr. Bennett, you first.
Well, let me just say this. I think it's really important. The family history that I had, I thought always family history was going to be on my mother's side, and there's no cancer on her side of the family. So come to find out, my father's sister had breast cancer. So therefore it was on my father's side, but no positive results for the BRCA gene. We have a board member who was 26, whose husband played for the Oilers at Houston Oilers at the time. And she experienced the same thing that Amber experienced. Went to the physician. Oh, no, you're too young. We can't do a mammogram on you. You're too young to have breast cancer. And she said, well, my mother had ovarian cancer. And he said, oh, don't even worry about it. Come back in a few years. Well, if she had waited, then she said, I would have been dead by now. She said, but I was persistent. Renee Wilson, who was one of Dr. Silva's patients, also was in our support group. Renee was 26, I believe, when she was diagnosed. And they told her the same thing. Oh, no, you're too young to have breast cancer. And not to criticize the physician, they are going on what they were trained. As Amber and Renee told me, and Lisa, my spirit did not sit well with this. Therefore, I was persistent and went to see somebody else. Or if they didn't tell me who to go see, then I went on my own and found someone else to go and see with a positive diagnosis. So it's really, really critical. And I always tell people, no matter how old you are, go get a second opinion. Always.
Yeah. Dr. Silva, as a physician, I'm sure you have people who have come to you, and I don't know if they've ever had to insist on a second opinion, or you've been the second opinion that people have come to. Just talk about patients and the importance of them being persistent in taking responsibility for their own care.
Absolutely. And it's just as you said, Dr. Cofield, sometimes patients come to me for the second opinion, but definitely if I have a patient, especially, when they're hearing maybe the worst news they've ever had to experience in their life, and it just is overwhelming to them, and they just don't maybe even want to hear what I'm saying, because it's just nobody ever wants to hear those words, breast cancer. I encourage them, if this doesn't feel comfortable to you, if you feel like I haven't answered questions that you need answered, please get a second opinion. What I really want is I just want patients to get care. Most heartbreaking thing that I see happen, and fortunately it does not happen very often, but the patient who just gets so terrified that they just walk away and they don't get any treatment. And so that is what I don't want to happen. So a second opinion, a third opinion, but also you need to feel comfortable with your doctors. Even if you believe what they're telling you and you think what they're saying is right, you have to feel confidence in them, and you have to feel comfortable with them, and you have to feel like that you can talk to them and share your concerns. And if those personalities don't match up, then you should go talk to somebody else.
Now, before I go back to Amber, she talked about the discharge being followed by a mass. Dr. Silva, is that typical in terms of the progression? Is the discharge kind of the first stage of that, and then the mass will come? Now, I know some women won't get a discharge, they'll just find a mass. But if you see a discharge, is that kind of stage one, sound the alarm, and then that mass will follow after that?
That's a really good question. So yes, most breast cancers start in the lining of the milk ducts. That's when it's stage 0 or non-invasive. It's called ductal carcinoma in situ, or DCIS. So most of it starts in the lining of the milk ducts. And when you have that, one of the signs and symptoms can be the nipple discharge. Given enough time, the cancer will start to move outside the milk ducts into the tissue surrounding the milk ducts. So in the tissue, the fatty tissue around the milk ducts. And that's when you can start to feel a mass. So yes, I would say that's kind of the natural progression, that it's going to start in the lining of the milk ducts. You may not even know it's there. It may only show up if you get a mammogram, and they'll see what we call calcifications, and that'll be the tip off, or it could be the nipple discharge. But given enough time, and that could be years of time, it could be a long period of time, but given enough time, the ductal carcinoma in situ will most often progress to a mass and an invasive breast cancer.
We're going to take a break. We'll be back in just a moment. And after the break, we're going to hear from Amber to hear about her diagnosis and the treatment and where she is now in her journey with breast cancer. We'll be back in just a moment. You're listening to Real World, Real Talk with Dr. DZ Cofield on your member-supported radio station.
Download our new I Am Hope mobile app in order to get or stay connected to our Good Hope family. To download the new app, you can visit our website at goodhope.org and click on the banner, or you can text Good Hope MBC app to 77977, or you can scan the QR code on the posters in the lobby or Center for Hope, or you can also search Good Hope MBC or I Am Hope in your Apple or Google Play Store. Let's continue to take hope to the world.
Welcome back to Real World, Real Talk. I'm Dr. DZ Cofield, and you're in the virtual studio with my guest, Dr. Jenny Bennett, the founder and director of Reconstruction of a Survivor, a curriculum-based breast cancer support group, Dr. Colleen Silver, who is a surgical oncologist and director of breast cancer services at UTMB, and Miss Amber Thomas, who was diagnosed at 21 years of age with breast cancer. She is 25 now, healthy, student, working, and is a volunteer with Reconstruction of a Survivor. Amber, before the break, we were talking about your journey and how you discovered that you had breast cancer. For those who may be just tuning in, just in the form of summary, you had a discharge from a nipple, and then that doctor that you first saw said, hey, it's nothing, didn't rest well with your spirit or the spirit of your mother. You went back, you ended up getting a second and third opinion, and by the time you got that discharge had formed, and now you had a small lump, as you stated, just above your areola. Here's what's interesting to me. What was the timeline between the time that you went to the first doctor and the second or third doctor when you saw that lump forming? Was that months, years, or weeks? How long was that?
So as I stated earlier, I was still at Texas State University. So I would have to come back during the week because I still had classes and work out at San Marcos. So that second opinion had to be within 2 weeks.
Wow.
Within 2 weeks. And so I went, and the first thing that I got was a lumpectomy. So they went, did the lumpectomy. After that, they tested the lumpectomy, and they found the cells. They found, I don't want to say them incorrectly, but they found cells, and they wanted to make sure it didn't spread outside of the lump. And so that's when I went to the Rose and I got a biopsy. The biopsy came back benign, but it was, so when they told me the first time, they said it was benign. And afterwards, a nurse came in, and she was like, she went over it with me because, I don't know what these things mean. So she went over it, and she was like, although it's benign, it is high risk. So you could just, leave it, wait a couple years, or you can just decide to move forward. And
now, Amber, let me stop you there, because I want Dr. Silver to step in. Please explain to our audience this idea of benign but high risk, because I think we typically think benign or cancerous as kind of the two choices, and if it's benign, everything is fine, if it's cancerous, then you need to treat it. What is high risk benign?
So I don't have Amber's specific background to know what she had, but in general, there are types of fibrocystic changes of the breast that can be signals that there's something about your breast tissue that's going to make it more likely to develop cancer cells. So if you get back a biopsy with a needle, because remember, that's just a small taste or small bit of what they're seeing there. It's not the whole thing. And it shows atypical cells or abnormal cells. That can be a marker that, hey, there's something going on in this breast, and it may not be cancer now, but she's going to have a much higher chance she could get breast cancer in the future, and maybe not even in that same spot. It's just something about her breasts that are going to be increased risk. So we need to be on more high alert for this patient. If we don't go on to diagnose cancer in this patient now, we need to make sure we're seeing them frequently, at least twice a year. They're probably going to be recommended to get a mammogram, and then the next 6 months get an MRI. So there's just going to be more high alert related to that particular patient if we see these abnormal cells. But generally, as Amber mentioned, once the biopsy shows the abnormal cells, because again, as I said, that's just a small bit of what they're seeing, we go in and we remove that area completely, as in a lumpectomy, as Amber described for herself. And so that lumpectomy, now the pathologist has a lot more tissue to look at and to determine, yes, there is actual cancer here, or this is abnormal or precancerous.
Okay, and Dr. Silva, before we go back to Amber, when she talks about the timeline of the movement from this discharge to a lump on her breast, is that typical in terms of the speed or the progression? I guess I would think of it as the aggressiveness of the cancer, or was that specific to her?
I think that is more specific to Amber. It is, I would say it's not typical to develop a mass immediately within a couple of weeks of the nipple discharge being noted. So it's possible that based on where Amber was in her hormone cycle, because at different times of the months, women's breasts can feel lumpier than others. So maybe that came more to the forefront and she could appreciate that lump better, based on where she was in her cycle. It also could be that maybe, I'm really just coming up with a theory now. But the bottom line is that no, it is not typical to go from nipple discharge, no mass, to a mass in that short amount of time. So that's a pretty unique part of Amber's story. And again, why I'm so, glad that she and her mother persisted in getting this figured out.
Yeah, absolutely. Okay, Amber. So pick up your story now. You get this lumpectomy, right? And they determine that it's benign but high alert. They're keeping watch. You haven't gotten the big C diagnosis yet, but just tell us where you were emotionally, how you were feeling in the midst of all of this.
From the beginning, it was such a shock. I think the hardest part for me was telling my family, because I didn't want them to, I just didn't want them to freak out. I didn't want them to be more sad than I was. So I really just kept it together the entire time. But it all worked out because my family and friends were very supportive for me. So that's how I got through it. But I would also like to say with the mass, I was also on birth control next to Nexplanon. So the doctors also feel like it kind of probably sped it up because you can't have birth control as someone who has cancer. So after a couple months, I also got the birth control removed. And when I got the biopsy done, it was the cancer was stage 0. So I found it really, really early. And so after talking with my doctor, she suggested that I remove the breast that we found it in. And I wanted to remove both because I didn't want this to be another scare, as I got older, and I honestly wanted that whole situation to be over. I didn't want to have to repeat it. But my parents and my doctor was like, you're only 21. They don't think it'll be a good idea. So the day that my doctor, told me, what she wanted to do and gave me my options, and I just decided to remove my right breast. Honestly, at that point, there had been so much going on. I was really grateful that my option was to remove a breast instead of, you only have a couple days, or, just any type of worse diagnosis. I don't know why, but I was really grateful to hear that, that's not small, but I was just grateful to hear that that's what I had to do to move on and get better. So by the time I got it removed, it was stage 1.
Okay. So, Amber, I think, and the reason I asked how you were feeling is because I think in the midst of any medical diagnosis, sometimes people minimize the power of emotions and your emotional state and your mental well-being in the midst of seeking treatment. And so I appreciate you being transparent with us and sharing that. And then I think the other thing is, so many women define themselves and the world defines them by their body parts, breast being a big part of, the visual that we see of women, that, for you to make that decision the way you did, I want to, if it's my place, commend you for just your courage to be able to say, I'm choosing life, and I'm recognizing how serious this is, and for you to make that decision, I think was powerful. Dr. Silva, can you talk about that progression? I don't know what type of cancer Amber had, but even to go from treatment, and maybe Amber, I should ask you this first. And Dr. Silva, if you want to ask Amber questions, you certainly please feel free to do that. What was the timeline from when you went from stage 0 to stage 1? Was that over a year, a 2-year period? What was the timeline for that, if you can recall that?
It was within a year because all this started around June or July of 2017. And I had my last surgery that December of 2018, where I was told that the cancer was gone. So I was cancer-free in December 2018, but all this happened within a year. Because I also had to, wait because, it's very expensive. So, even after they told me, what you have to do next, I couldn't, just go do it because of how, sorry, y'all.
Yeah, no.
How expensive it was. But I had a lot of family and friends who helped me pay for things. And also my doctors, Dr. Terry and Dr. Boutros, they went out of their way to help me with certain things. Like they just went out their way. Certain things that they didn't charge me for, even with connecting with different surgeons to figure it out. So
yeah. So let's talk about that, the issue of cost, because we're in a state that refused to expand medical coverage. We have estimates say somewhere between 2.5 and 3.5 million people who are uninsured or underinsured in our state. Let's talk about cost and how that impacts people coming to you, Dr. Silver, both for the diagnosis as well as for the treatment. and what's available out there, because I can imagine for you as a medical professional, I mean, it's your profession, you get paid, but you certainly don't want somebody staying away from life-saving treatment because they don't have insurance.
That's correct. So I'm so glad that you brought this up. And Amber, I'm sorry for the struggles that you had to go through. It's just on top of, knowing you have cancer, it's a burden. So there are a lot of resources that we have in the state, we need to do a better job of getting that information out there. So, for instance, at UTMB, we participate in the Breast and Cervical Cancer Screening Project, and that's administered through the federal government with matching funds from the state. It's been in existence for 30 years, but that will pay for mammograms and pap smears for women who are uninsured and meet certain financial qualifications. So if you find you have a lump, there are places that you can go that you can get a free mammogram. UTMB is one of those places, but there are definitely other places in this area of Texas. And I know this show has a national and international reach, but at least for Texas, there are a lot of resources through the BCCS program, the Breast and Cervical Cancer Screening Project, to get a mammogram. And many other states participate in this program as well. So that's for getting the mammogram in the first place. Secondly, if you are diagnosed with breast cancer in the state of Texas, and cervical cancer in the state of Texas, there is a specific Medicaid that is just for breast cancer and cervical cancer patients. And again, that's through this BCCS project. So at UTMB, we actually have a navigator that if you are screened and get a mammogram through the BCCS program, and they do a needle biopsy and they show you have cancer, then we can automatically shunt you into screening to see if you're eligible for the breast cancer Medicaid. And so many, many women out there are eligible for insurance that will pay for all of their coverage of their breast cancer and any other illness they have during that time for the 5 years that they're under active treatment for their breast cancer. If they're still on active treatment for 10 years, because some patients are on a pill type of medication that they have to take for 10 years, it will cover them for the 10 years. So there are resources out there, and I just feel like we need to do a much better job of getting that information out there to people.
That's so powerful. And I think, again, all of us know that knowledge is power and information. It's just amazing to me how many of these programs we just don't talk about it. It's there, but we don't talk about it, and it's almost like we want to have the funding there, but we don't want to spend the money. Like you would think somebody with the prevalence of breast cancer in our society, you would think that people would actually be promoting these programs and talking about these programs and helping people know they're available, like Amber in her situation. And thank God she had family. Thank God she had compassionate doctors. I've done shows in the past, for example, where hospitals like MD Anderson, people had to sell their homes to get prostate cancer treatment, which to me is just unbelievable. Mm-hmm. That in our state that prides itself on being number one, somebody would have to sell their home to get treatment from a publicly funded medical facility. But we'll save that for another show. Dr. Bennett, let's talk about the pressure that people feel, because I know even though Reconstruction of a Survivor is a program for breast cancer survivors, there are many people for whom you are the front line of people who may think they have breast cancer or may have been diagnosed but don't know where to go. They've heard of you and they call you. How do you help people navigate this and find a path to treatment?
Dr. Cofield, I think it is so critical that I thank God, because I've been allowed to even go to the doctor's appointments with women. and as well as to have them navigate, be a personal navigator for them. No, you may need to go get a second opinion. That person can give you correct information. And I think the most important thing is that nowadays, with the affordable health care, some major hospitals, one that you mentioned, will not accept your affordable health care insurance at all for cancer treatment. I don't care what kind of cancer it is, they will not accept it. The second thing is, when you've got, like Dr. Silva mentioned, the BCCS program, oftentimes the woman may not know that it's there, number one. And number two, I always ask, I even told one lady once she had insurance and her deductible was so high. I said, tell you what to do. Drop your insurance, get on the BCCS program before you actually start treatment. So to me, that makes the most sense. Well, what if I get something else going on? Well, you have to reach in your pocket. The second thing is that I tell people all the time, women, males, females, it doesn't matter. Always find out if there's a foundation that the hospital will allow you to apply for funding to help with your treatment, and or tell them to put you on a payment plan. And those are options that no one ever thinks about. That's why the person sold their home. I don't think they were asked. They had the right information to say, look, you may want to see if there's a program within the hospital setting, or see if you could apply for making payments on a monthly basis.
Yeah.
And I think it's lack of knowledge, lack of information in all areas, and not just with breast cancer, but other types of cancer and other illnesses.
Yeah.
So,
I'm sorry. Go ahead, Dr. Silva.
I'm sorry to interrupt. I do think we try very hard to get the information out, but we're doing it at a very local level. So we're, going to speak at a church, in Galveston or in Galveston County. So we're trying, but we don't have a big public voice. We don't have a big statewide or national voice. So, wouldn't it be great if we had television commercials from the state of Texas saying, Absolutely. Hey, get your mammogram this month because you probably qualify under our BCCS program? That would be wonderful. Let's have a statewide voice, because Dr. Bennett and I, we're out there talking, but we don't have a public megaphone. We can't get to everybody. So it would be nice if there was more at the higher up level, that was promoting this than individuals at individual hospitals or individual clinics or individual mammogram places trying to do it on their own.
It's really just about priorities and what's really important. And, we prioritize partisan political, issues, and, we're trying to grandstand and, outshine a governor from another state, for example, or get national headlines. And breast cancer is a nonpartisan issue. It's a public health issue that affects, Republicans, Democrats, independents, and everybody else, depending on where you are on the political scale. It has no respect of person, religion. And so it's really important, I think, that we demand that our public officials not only fund it, but make it known that it's available, and share that good news for somebody who needs that good news. Amber, tell us where you are now. You were cancer-free in 2018. You're volunteering now with Reconstruction of a Survivor, but tell us where you are in your journey and life, and how are things going?
So after that diagnosis, the cancer-free diagnosis, I went through the reconstruction, and that was a whole thing right there. But because at the time, I couldn't go to school, I couldn't work, I couldn't do anything. I just had to sit at home. I was so ready to get up. I didn't know what to do. So once I got up, I tried to stay active. So I jumped in. I became in a women's group. I just started, helping in any way that I can, because for me, it just really taught me, to be honest, you never know where somebody, what they're going through, or even mentally, what they're going through. You can go to work with them every day, because that's how I feel. I'm going to work every day. I'm going to class, but I'm still struggling. I'm still having issues. So now my biggest thing is, if you can help, wherever you can, because it's more benefit out of it. And it honestly just helps me, even with Reconstruction group. Like when I first joined it, I mean, even hearing other women who tell, they telling their story, and I can relate. It's the difference between you telling your story to someone and they, just so shocked. They, you're just telling them, they getting amazed, they getting wild. But to actually be able to sit down and talk to somebody who can, know exactly what you're going through, it's amazing. So
for somebody just tuning in, we're talking about breast cancer awareness. I have with me in the virtual studio Dr. Colleen Silva, who is a surgical oncologist and director of breast cancer services at the UTMB here in Texas. Dr. Jenny Bennett, who is the founder and director of Reconstruction of a Survivor. It's a curriculum-based support group. They have 9 locations. And Amber Thomas, 25-year-old young lady who was diagnosed at 21 years of age with breast cancer, has had a mastectomy and is cancer-free now. And she has been telling her story with us on tonight. If you missed any portion of Real World, Real Talk, you can listen on our podcast and hear all of the information that we shared on tonight. A lot of times we don't connect the dots in the cause and effect of what we're experiencing and what we're doing, especially for those who have a family history of breast cancer. And to Dr. Bennett's point, it doesn't have to be on your mother's side. It can be on your father's side. And if it's on your father's side, your father may not know, because, it's not typically something that, women share with each other. They don't necessarily share with men. And when they share with men, we don't necessarily listen when they're sharing. And we don't necessarily identify what's really important and think about the generational impact of those diagnoses and things like that. So if you can talk about the birth control, but also talk about Amber's age and ethnicity, because, historically we have seen African-American women, whether it's triple negative DCIS or other forms of cancer, being more adversely affected by cancer, getting more aggressive forms of cancer, and not having the insurance to get treated. So if you can talk about those two issues as we prepare to close our show today.
So yes, the birth control part is if you're on a birth control that has hormones in it. So like the Nexplanon, which is the implant that you had in your arm, correct, Amber?
Yes.
That secretes female hormones every month, and that keeps you from getting pregnant. So you can use birth control pills, you can use birth control forms that don't require hormones. So you can use condoms, something that doesn't require using a hormone-based birth control. It's the same thing as to why older women after menopause who've gotten breast cancer, we don't want them to take the menopause hormones, the estrogens that people take, because a lot of the tumors are stimulated to grow in the presence of the female hormones. So it's like the female hormones feed those tumor cells to want to divide and multiply and grow. So we're trying to shut down all the forms of the female hormone that could do that. And so that's why the Nexplanon, which is what she had in her arm, or the birth control pills are not generally recommended. Interestingly, there hasn't been as strong a connection with the birth control pills as there has been with the female hormones after menopause. That's pretty clear cut, that there's a connection between increased risk for breast cancer and the menopause hormones. But there's not as strong a cancer connection with the birth control pills. But everybody just tries to be really, really cautious because they don't want, any possibility that we could encourage a cancer to start to grow again.
Got you. And can you talk about just the ethnicity? Amber's a young African-American woman, and
Yes.
and the importance of African-American women, really, really looking at themselves and
Yes.
being observant of cancer or possible cancer in their lives.
Yes. So it's absolutely true that we see a higher percentage of the more aggressive breast cancers, the triple negative breast cancer in the African American woman. And we're making a lot of progress. We're making a lot of, learning a lot of things about medical treatments, chemotherapy, immunotherapy that's working for these women. So that's the good news, the positive, that we're making a lot of progress and we're increasing survival. But yes, it's definitely more prone to those more aggressive cancers. Also think that we need to be thinking about doing the genetic screening more. If you have a family history of breast cancer and your mother or your grandmother and they've now passed away, you need to think about talking to your doctor about getting tested, because maybe you're carrying a breast cancer gene that you didn't know that you had. And so we need to be watching you much more closely, or even thinking about doing, prophylactic surgery before something actually does happen. So I think that's important. So yes, so we can remove your breast completely. You still have your skin, and in certain cases you still have your nipple, but your breast tissue underneath the skin is completely gone. And that's called a mastectomy. And there have been women who found out that they have a breast cancer gene, and they make the decision to have their breast removed, to have mastectomies before they even get cancer. The most famous example of that is Angelina Jolie. She found out she was carrying the breast cancer gene because her mother had died of ovarian cancer, and she made the decision to have both of her breasts removed. And that was really fortunate, not fortunate for her, but that it got it out there in the public awareness and people started talking about it. So prophylactic means we remove the breast even though we haven't identified that you have breast cancer yet, because we know the chances that you're going to get breast cancer are very high. But even if you don't want to have your breast removed, and many women do not, even if they know they have the gene, there's still other things that we can do to watch you more closely. We can get mammograms, we can do MRIs. There's certain medications we can give you that may, suppress the cancer from forming. So there are lots of things that we can do. So if you find out that you've got women on both sides of your family, this isn't a mom disease. This is a mom and dad family problem. So on both sides of your family, if they're grandmothers, cousins, aunts, anybody who's had breast cancer, and there's more than one of them, especially if they were younger, you need to think about talking to your doctors about genetic testing and genetic screening. The other thing I want to make sure people are aware of, because I don't think that reconstruction is talked about as much as it needs to be, meaning, as Amber said, getting the breast reconstructed after having had the breast removed. That is covered by insurance. It's actually mandated that breast reconstruction is considered part of your breast cancer treatment. So if you have insurance, and I understand Amber's situation was somewhat different, but people think that, this is cosmetic. Nobody's going to pay for me to get breast reconstruction. That's just absolutely wrong. And if your doctor isn't talking to you about reconstruction being done at the time that you had your surgery or down the road later, as I think, Amber, you need to ask why. Why can't I have reconstruction? Because it is available and it is there.
Dr. Cofield, let me throw in one other piece of data that I think is important. One of the things that oftentimes people don't promote or mention is that more white women are diagnosed with breast cancer. However, more African American women die from breast cancer than any other ethnic group. And those are data that have been talked about for years, but no one's really put an emphasis on it. And that's why we do our breast health education, to make women aware, particularly African American women, aware of this. I can always remember as a child being told, well, you get cancer, they cut on you, you die. And that's, again, a myth. So there's a lot of misinformation out in the public in the African American community, I know, specifically speaking. But again, there's a lot of good information that should be promoted in the African American community that is not.
Well, I appreciate it, Dr. Bennett, Amber Thomas, Dr. Silva. Thank you for being with us. Dr. Bennett, if somebody wants to contact Reconstruction of a Survivor, I know there are a lot of women who are out there, even though you do a great job of sharing the information of your organization, who may be out there suffering alone. Maybe they heard about it, but they didn't write down the information. Maybe just the timing of it is such. And coming out of COVID, coming out of everything that we've been dealing with, they need that support group. How can they get in touch with Reconstruction of a Survivor?
Thank you for asking. There's several ways that you can join us. Number one, we have our website is www.reconstructasurvivor.org. Again, reconstructasurvivor.org. Some of our support groups now are virtual. Some are in person and virtual, which is a hybrid model, and some are just strictly in person. The other thing is that we do have a phone number, which is local to Houston, 713-741-4422. And again, our curriculum is transportable. We can go anywhere in the United States with the curriculum, but we train the leaders of the group. All of our facilitators have been trained how to use the curriculum, what to do, what not to do, what to say, what not to say. And the curriculum is actually a guide in terms of how do you conduct that session.
All right. Give us that number again. 713.
713-741-4422.
713-741-4422.
Yes, sir.
Thank you so much for being with us on today. Thank all of you ladies for being with us on today. We really appreciate it. Thank you for your story. Amber, thank you for your courage. And we're happy that you're cancer-free and looking forward to the great things that God's going to do in your life and through you.
Thank you so much.
Thank you.
The late Vernon John said, if you see a good fight, get in it. I always add, if you don't see a good fight, start one. And the fight for your health is a fight that you definitely want to engage in. And we know the monster that cancer can be, whether it's colorectal cancer, prostate cancer, which had its awareness month last month, or breast cancer awareness month. Thousands and thousands of people lose their lives every day, every year, I should say, every year to the battle of cancer. I just had to say farewell to a mentor, a man who has meant so much to me, who passed away from kidney cancer. The cancer was diagnosed last November. He notified us, and we just had his homegoing celebration. Early detection is still critical, and it's important for you to be aggressive about your health, about your wellness, to make sure that you press doctors. And if something is not resting well in your spirit, don't just write it off. Make sure that you articulate how you're feeling. Get that second or third opinion. Stay vigilant about your health, because after all, it's your health. I want to thank Dr. Jenny Bennett, Dr. Colleen Silva, and Amber Thomas for helping shed light. And here's my hope and my prayer, that today's show will save somebody's life. Maybe you have that discharge and you've just kind of written it off. Maybe you felt a lump, but somebody told you it's not bad or it's real small. Listen, act on it. Make sure you get the help that you need. Do the research, find the treatment, find the places, even if you don't have insurance, where you can get the help to take care of your health. Until next time, this is Dr. DZ Cofield for Real World, Real Talk, signing off. Peace.
Thanks for listening to this episode of Real World, Real Talk. Be sure to subscribe to this podcast to be notified of new episodes every week. Follow us via social media using the @RWRTDZ username on all platforms: YouTube, Facebook, Instagram, and Twitter. To submit any comments, questions, sponsor opportunities, or future show suggestions, visit us online at rwrtdz.com or via email at info@rwrtdz.com. Thank you for listening, and we hope you've been inspired to be the change you want to see in the world today. Until next time, be real, keep it real, and stay real.